Hello everyone. Today I would like to discuss with you a case of Tetralogy of Fallot. I would like to remind you the abnormalities. First abnormality is right ventricular hypertrophy. Second abnormality is ventricular septal defect. The third is pulmonic stenosis. And the fourth is overriding aorta, comparing with the right, which is the normal heart. And now let's go to our case. This is a young lady, 21-year-old, who had repair of Tetralogy of Fallot, and I would like to show you the images. First of all, this was an urgent case, and she presented with acute onset of chest pain radiating to back, and the clinicians suspected aortic dissection. Anyway, in this case, we can see that the ascending aorta is significantly dilated. There is aneurysm here, measuring approximately 5 centimeters. But apart from this, I would like to show you some anatomical changes related to Tetralogy of Fallot, and let's see some of them. I will scroll the images up and down to have your first impression. And then I will explain you the abnormalities, the anatomical abnormalities. First of all, a very interesting finding is that there is a left-sided inferior vena cava. Let's see the vessel. Here is the abdominal aorta, and on the left side is the inferior vena cava. Let's follow the vessel and see downwards. This is really very rare and very interesting. By the way, there is a retroaortic right renal vein, which is another anatomical variant here. As you can see, the right renal vein passes posteriorly to the abdominal aorta. So let's go down, and we can see the bifurcation of the left inferior vena cava. Okay, so here is the right and here is the left common iliac vein, and goes on. Okay, here is the bifurcation of the abdominal aorta. Let's go up again, and let's go to the heart. But before we go to the heart, I would like to show you where the left inferior vena cava drains. This is again very interesting. Okay, we follow the vessel here, and we can see the drain right here. This is the conjunction, and here is the left innominate vein. Here is the right innominate vein. Okay, normally these two veins form the superior vena cava, but actually there is no superior vena cava in this case. Here is the right innominate vein, here is the left innominate vein, and here is the conjunction between the left-sided inferior vena cava and the left innominate vein. Okay, normally these two veins form the superior vena cava, but as I told you previously, there is no such a vessel in this case. So from that point, all these veins must drain somewhere. Let's follow and see the anatomy in this case. At this point, here is the right atrium, and let's follow this structure here, this one, and we can see the conjunction of these veins, the left inferior vena cava and the left innominate vein. So the drainage is going through this structure here down to the right atrium. Okay, now as for the ventricular septal defect, it looks like there is a closure here, and there is no any communication between the left ventricle and the right ventricle. So the septum here looks intact. Okay, here is the left ventricle and here is the right ventricle. Now let's go back from the right ventricle and let's try to see the pulmonary circulation. Okay, so here, follow my arrow, here we can see the pulmonary trunk. Okay, let's go back again. Here is the right ventricle and here is the pulmonary trunk, and the right main pulmonary artery and the left main pulmonary artery. Now let's have a look. Let's have a look to the right atrium, which is here. Let's go down and we can see that there is a very short right inferior vena cava, and here are the hepatic veins, and there is no continuation on the right side. There is no right-sided inferior vena cava in this case, only on the left. Let's see it again. Right atrium, let's go down and we can see the short right-sided inferior vena cava, which is here, and we can see the hepatic veins. Now we can see again the aneurysm in the ascending aorta, and the overriding position, which goes here, which is the left ventricle. Once more, I will scroll the images slowly from up downwards to have a general look again. So you will better be familiarized with this congenital condition, congenital anomaly. Dear friends, thank you for watching. If you like my videos, please subscribe. So see you the next time soon again.